Hello, my name is Brook Ward. I'm the President CEO of the Washington Health System. Happy to be back as part of our ongoing Friday video series where we attempt to give you updates about what's going on. We want to start with the updates and changes to the Pennsylvania COVID restrictions that were effective Monday, March 1st. Those start with the restrictions on indoor events. They've raised that to 15% of total occupancy as long as that venue can maintain social distancing. For outdoor events, they've increased that to 20%. And they've eliminated the out-of-state travel ban or requirement to have a negative COVID test before you come back into the state. Now, with that being said, it's important to note that the CDC still recommends we don't travel because it's a way you can, of course, get COVID and spread it to others. And so they recommend you don't travel if you can avoid it. And all of these restriction changes do not eliminate the need for face covering or mask, social distancing, and hand hygiene. All of those things are still extremely important. Now, again, I'm very optimistic about where we're going as a state and a society. The inpatient COVID numbers are down, deaths are down, even the outpatient positivity rate is going down, while vaccinations are going up. And at the state at this point, we have approximately 2.4 million people who've had at least one vaccine dose, if not both, at this point. But we can't let our guard down. We need to continue to be cautious, continue to wear a face mask, even if you've been vaccinated, and continue to have social distancing so we don't have a spike in numbers. We know today that there's a mini spike happening not that far away over in Steubenville as we speak. And so it can happen in our market. We need to be close, careful, and positive. Now, positivity rate for the infections in our area is dropped down to 6.3%, and that's down quite a bit from the 12% of the people who came into our COVID testing sites in February. So 6.3 is great, but keep in mind that's a long way from where we were last summer and spring when it was around 2%. So it's still high compared to where we were about a year ago, last spring and last summer. So we do need to remain and be cautious, be diligent, protect yourself, protect your family. Now let me move on to vaccination. As you heard me say already, we have about 2.4 million people in the state of Pennsylvania who've had at least one dose. Not all of them have had all the doses at this point. And so we're moving in the right direction. That means about 18% of all Pennsylvanians have had at least one dose of the vaccine, which is good. We at the Washington Health System have actually done a little over 18,000 vaccines. We by far provided the most vaccine to residents in Washington and Greene County of all providers combined. And we like to move faster. We have the capability of doing around 10,000 doses per week. Our issue at this point is we're just not getting enough vaccine supply, as you can imagine. We're only getting between 2,000 and 3,000 doses per week, and about half of those, remember, have to be saved for second doses. So we have about 37,000 people on our waiting list. We're working through it as quickly as possible, but again, as you've heard me say in the past, we're all going to have to remain patient because at the quantity of supply we're getting, it's going to take us a while to get through that, but we'll move as quickly as possible. Now, I've had a lot of questions from people who have contacted me personally saying, I signed up on the Washington Health System website the first day you set it up, and I haven't heard back. Should I be worried? And the answer is no. As you just heard me say, when we're only getting somewhere between 1,000 and 1,500 doses a week for first doses, it's going to take a while to get through people. Now, I'm optimistic, as you heard me say earlier, that more vaccine will become available. We'll be able to ramp that up, and hopefully we can get to people quickly as possible. The other question that often comes up from people is they don't hear from us and they sometimes miss their appointment. And when we get back to them and when we check, the email went in their spam folder, telling them when their appointment was, the date and time. And we've had requests from people to change our email so it doesn't go in the spam folder. Unfortunately, that's not in our control. That's the control of your email system and your software. And so we're reminding people, and I want to do that today as well, check your spam folder to make sure you don't miss anything from us and miss your potential appointment and miss your opportunity for a vaccine. Now, as a reminder, we're doing vaccine clinics in Waynesburg at the lower level of the Washington Health System Green. We're doing it in Washington at the Crown Center Mall, and we're doing it at Peters Township in the Peters Township Rec Center Gymnasium. We have the capability of running all of those sites 6 days a week, 9 hours a day if we have to, and we can do over 10,000 doses. But again, we're just not getting that much vaccine. And so we're not operating all those clinics at all times right now. We want to be as efficient as possible. Now, if you want to sign up for the vaccine and you qualify for Phase 1A, you can go to our website, WHS.org/vaccine form, and sign up and put yourself on the list. Happy to work with you to try and get you in as quickly as possible. Again, have to remain patient. We know, and as I already said, the vaccine supply is limited. Now, at all of our sites, it's appointment only. There's no walk-ins and no trades. So please don't show up with an appointment and expect to sit there and get one. And don't, if you have an appointment from us and you've gotten the vaccine somewhere else, don't show up with your aunt, your cousin, your neighbor and expect to trade. It doesn't work. We're asking everybody to show up at their appointment time, wear a mask, bring their photo ID, and we'll confirm that the person who's there actually matches the appointment. We'll get you in. But no walk-ins allowed. Another thing that's been happening lately is people show up for their appointment way before their time period and they want to come in early. And I can understand that, but if you don't mind, please wait. Don't show up any more than 10 minutes before your appointment. It just bogs down the process. If you do get there early, please wait in your car and then come in around your appointment time or within 10 minutes. That'll work great. Now, another thing you can help us do is we have a number of people on our list who have gotten the vaccine somewhere else, which is great. But we need you to do us a favor and let us know by canceling your request. We don't want to waste an appointment slot, and we definitely don't want to waste anybody's time. And as I've told you before, there's a few of us, thousands of you. So if you don't tell us you don't need it, we get to you. We spend time and effort to schedule, communicate with you, and tell you. And then you tell us you don't need it. We got to redo all that work. Or worse yet, that time slot gets wasted. Now we're not going to waste any doses, and we haven't. But that's a time slot that could have went to someone else that was wasted because you didn't tell us. So if you've gotten the vaccine somewhere else or changed your mind, again, go to our website, WHS.org/vaccine form, scroll down and you'll find a button called appointment cancellation form. Click that. It takes 30 seconds or less, and that will take you off the list. It's the right thing to do. It will do us a huge favor. It won't waste any time on our staff or anybody else, and it won't waste that appointment slot. We would really appreciate you following through on that. So these are really important. That'll help us get through the 37,000 people who are waiting. Now, overall, the vaccine clinics are running very well. We're getting tons of positive feedback from people about how efficient it is, how easy it was, and how well that worked. And we appreciate all that positive feedback. And if you have any suggestions on how we can continue to make it better or improve it, we're willing to hear that as well. We have gotten a lot of questions this week because on Wednesday this week, the governor surprised us with another announcement suggesting and highlighting the fact that the J&J vaccine is going to be coming to the state of Pennsylvania is going to be pulled aside and given to school employees only through a special process with the National Guard. So a number of school employees have contacted us asking how they can get J&J from us, and they can't. They're going to have to go through their principal, their superintendent in the intermediate unit to figure out how that all works. And I'm actually hoping that all the school employees then will come off our list because they're going to have their own special quantity, doses, and process. That way we can get to the rest of the public faster. I'm working with the intermediate unit as we speak to figure out how that's going to work, but I'm hoping this will help teachers and will help us get to the rest of you as quickly as possible. Now, we've had a lot of people ask, are we charging for the vaccine? And the answer is no. We've also had people ask, are we billing insurance? And the answer is no as well. We technically could bill your healthcare insurance for the injection. We're not billing for the vaccine. That's coming to us free of charge from the federal government through your taxpayer dollars. The reason we're not billing your health insurance for it is, on average, the reimbursement for that is $10. Not all payers pay at all. And it costs us more time and effort to actually bill the insurance company than we'd get back. And so we don't want to waste our time. We definitely don't want to lose more money, and we want to be as efficient as possible. So we're just doing it free for the community to make sure that we can get it out to you as quickly as possible. We're not going to worry about that. But if you feel like you've had a great experience, if you want to contribute in any way, when you go to one of the vaccine clinics, we'll have some donation envelopes. You can pick one of those up and you can help contribute if you'd like, or you can go to our website, go to the foundation page, and you can do a donation online if you'd like as well. Any donation and help you can provide would be beneficial. It just helps provide and care for everybody in the community. Now, a reminder about transportation. If you need transportation to one of the COVID vaccine clinics, and you don't have a car, don't have family or friends, you can get a free ride through Washington County Freedom Transit or in Greene County through the Greene County Transportation. Unfortunately, we can't give you a ride and we can't call and schedule that for you. So you're going to have to wait till you get the appointment date and time from us. Call one of those two organizations and they can help set up the transportation for you. Getting back to gratitude, as I said earlier, we've gotten lots of positive feedback from people about their experience, not only at the COVID vaccine clinics, but with all services. And we really appreciate it. We've been taking that feedback. We send it back to the departments where it came from, and sometimes to the individual employee if you give us their name. And so we want to encourage you to continue to do that. We're going to include a link down below that you can click to provide us more positive feedback, or you can just comment below this video. We'll capture all that and get that back to the right people. We really appreciate that gratitude and feedback from you, and it goes a long way with helping our staff as we do everything we can at the fastest pace we can to keep you safe, get you vaccinated, and care for all your healthcare needs, both COVID and non-COVID. And I want to take a moment to remind you that our environment, our facilities, and our procedures are safe. So if you have a healthcare issue that is non-COVID, don't put it off. Don't put your health at risk. Come in, let us take care of you, and make sure that we keep you healthy and safe. Those are our updates for this week's video. I hope you found it useful. Thank you for your time and attention. We'll be back for our next video Friday, March 19th. Until then, stay safe.